So our next speaker for the day is Dr. SANDEEP BHASIN. Dr. Sandeep presently is the founder of Care Well Medical Center, Delhi, a laparoscopic and cosmetic surgery center. He completed his MBBS from AMU and MS General Surgery in 1995. He worked in kidney transplantation from 1996 to 2000 in Batra Hospital. He also got trained in cosmetic surgery in 2009 to 2010. He specializes in the medical center specializes in ozone therapy, anti-aging therapies, hair transplantations, lasers, Botox, fillers, cosmetic surgeries, vitiligo management by melanocyte transplantation, stem cells, and intravenous drips for detoxification. He is also a founder of Meru Mantra, which deals in body, mind, medicine, and meditation. He is presently working on anti-aging, longevity, NAFLD reversal with diet, supplements, lifestyle modification, and intravenous protocols. His topic for today is anti-aging, medicine, recent trends, and pathways. Over to you, sir. Please go ahead and speak up on your topic. Yeah.
Okay, welcome everybody. And I want to thank all the organizers for such a wonderful meeting. And I know IFM is a very wonderful platform where we meet across the brilliant doctors all over the world and from India. And we come to know what's happening next in wellness and longevity and in functional medicine. So my topic for today is anti-aging medicine. And I'd like to share with you one study or small case which I have worked upon. And there's a 3-month study. The results I'm showing you in a small video, and then I'll continue with my presentation. So I'll just share this.
And I have been on a journey of weight loss. And my weight was almost 79. So कुछ भी खा रही थी तो ऐसा लग रहा था weight बढ़ता ही जा रहा है. I thought of first going for a weight loss program. Then I almost lost about 7 kgs. But then I came into a resistant mode. It was almost about 15-20 days. I have been taking proper diet, but बहुत ही resistant हो गया मेरा weight. And I was not able to reduce further. I came to Dr. Bhasin, and Dr. Bhasin then told me, I have to undergo some tests. So I underwent certain tests, and it was found that I was insulin resistant. And then he started working with certain drips, and I could see again another few kgs I could shed during his protocols that he had given. And I'm also taking certain supplement, though it was very difficult because he asked me to come, to have a very low carb diet, and it was very difficult to come to the low carb. But with the hand-holding of the team, it had become so easy for me to come this thing. And I have been on low carb for almost now a week, and I think I'm feeling comfortable. Earlier it was very difficult, but now it is not. And I have also started with extensive exercise plan, and I'm just enjoying. Let's see what's going to happen, and I'm very excited what is going to come up in the next 2-3 months. Thank you so much. Hello friends, I'm Leena, and I'm back again after 3 months. I have been taking this anti-aging protocol at Care Well Medical Center from Dr. Sandeep BHASIN. Today I'd like to let you know what are the lifestyle changes that were made. One, I was asked to exercise. Second was the diet. Third was my monitoring of the blood as well as other parameters like CGM, that is constant glucose monitoring. And I was also under supervision, my constant blood pressure. So I have to wear a smartwatch where my step counts, my blood pressure levels, and my sleep patterns could be monitored. I am also on supplements prescribed by Dr. Sandeep BHASIN. And I have been also on a low dose of hormones, very low dose of hormones. So I'd like to let you know what are the changes that I'm feeling after following this anti-aging protocol. I have been feeling not energetic. My stamina has increased tremendously. I'm able to hold weights much more than I used to hold earlier. I have been on a high protein diet now, and I think I'm enjoying my diet also, the diet that has been prescribed. As I just told you that I will not feel the cravings for sugars. And I'd also like to let you know that my blood parameters have also improved tremendously. So thank you, friends. At the end, I'd like to let you know that I feel much younger and youthful than ever before. Thank you so much.
Okay, friends, can you hear me? Am I audible?
Yes, sir. Loud and clear. Please go ahead.
That's a small journey which I shared with one of my clients to show how anti-aging is really a reality, where we start with blood investigations, dietary changes, and we use latest monitorings like constant glucose monitoring, Fitband, and things. And that can really help our clients to change the things and change their blood markers and look and become quite young. So I'll talk about what the hallmarks of anti-aging. There are 9 hallmarks that are now important for age, which determine how we are aging, like genomic instability, which tell that how the DNA is being damaged or not damaged. Telomere attrition, that means shortening of telomere. It's very important. As telomere shortens, our lifespan also shortens. Epigenetic alterations, we know methylation is now a big thing. And with methylation, we do change our epigenetic structures. Loss of proteases, it's about protein folding and unfolding. Dysregulated nutrient sensing, like insulin resistance is one form of problem in the nutrient sensing. So as we grow old, the cells are not able to sense the nutrients. So there is insulin resistance. Mitochondrial dysfunction. Now we all know that mitochondria is the powerhouse where the energy is generated. And as we grow old, not only the mitochondria is generating energy, it's the biggest source of creating reactive oxygen species. So a lot of reactive molecules are coming from mitochondria, especially if mitochondria are not functioning properly. Cellular senescence. So senescent cells are like old cells, zombie cells, which are supposed to die, which do not die. And then these cells cause a lot of damage to other cells, and they secrete a lot of inflammatory things in the blood. Stem cell exhaustion. So normally when we are young, we repair the tissues which are damaged. There's a lot of repair that's going on. But as we grow old, the stem cells get exhausted and we are not able to repair those damages. Then altered intracellular communication. We know how the cells crosstalk with each other. And when the cells stop cross-talking with each other, the aging process accelerates. So we need to replenish this, especially with the molecules like NAD, which can help in cross-talking. This is very important to help in anti-aging. So let's talk what can really help us in anti-aging and what all we can do. So nutrition is a very big part of anti-aging. If you can think that you can delay your aging just by supplements, I think you're mistaken. You have to start with the basic foundations. Nutrition and exercise are 2 basic things, and sleep comes the third one. So when you're coming to nutrition, read your labels carefully, keep a check on your calories, do not consume more calories, because the ample study that as we lower our calories, we help in anti-aging. Reduce sugars and refined sugars, increase plant-based food in diet. In all my studies, I'm getting whether it is fatty liver or anti-aging, that plant-based foods are the best for all this. Take more raw food and avoid endocrine disruptors like use of plastic and microwaves in your diet and your things. Now, foods to avoid, we all know sugars and refined sugars. They increase advanced glycation products, chemicals, processed food, all meat, especially they're preserved and processed, GMO foods, soda, soft drinks, estrogenic foods, and food that cause allergy. Then dairy, especially gluten, they should be eliminated. Foods that should be increased more in your diet if you want to come on anti-aging. Vegetables, especially cruciferous vegetables, green vegetables, whole grains, legumes, probiotics, and stop with red meat. Endocrine disruptors, non-stick pans, microwave, plastic bottles, they are really causing a lot of damage to our body. And if we want to prevent all that, stop using them. Come to, glass bottles, and ceramic dishes. Now, I want to tell you one thing. What are the pathways of anti-aging, if you can understand that? There are two pathways, catabolic pathways and anabolic pathways. Catabolic means they break down. So AMPK is a catabolic pathway. It breaks down the tissues, it generates energy. Anabolic pathway, it builds energy, builds muscles. You'll be surprised that mTOR pathway and other anabolic pathway accelerate aging, and catabolic pathway like AMPK deaccelerate aging. They make you live longer. So they're also called the longevity pathways. And mTOR pathway is also called mortality pathways because they are the one that make you age faster. So that is very important. The balance between mTOR and AMPK pathways is what will determine whether you remain young or you become old, whether you develop problems or you remain healthy. So that is something. The basic crux is you have to promote your AMPK and decrease your mTOR pathway as much as possible. AMPK pathway is also linked with autophagy, and it decreases inflammation and also causes weight loss. It also reduces senescent cells. Now, so this is what I am trying to say. And anti-aging, if you really want to work on anti-aging, you have to work. When we grow old, our mTOR pathway becomes more dominant pathway, and AMPK becomes down-regulated. Especially if you are taking a lot of sugar, your insulin levels are high, ATP is high, more of glucose, more of amino acids, they all will promote mTOR pathway and decrease AMPK. And this increase in mTOR is the anaerobic pathway, which causes increase in your aging, which cause more damage to the tissues, which create a lot of senescent cells, inflammatory cells, old zombie cells, which ultimately lead to a lot of diseases and mortality. So what is the thing that we have to understand? Now, what we have to understand is that with a lot of things that are happening with the aging, there's DNA damage, chronic inflammation, disruption of the circadian rhythm, microRNAs, and all of these now decrease the production of NAD molecule. Now, NAD molecule requires an enzyme called NAMT. NAMT gets down-regulated. On the other hand, PARP and CD38, these are two inflammatory path molecules, they start getting activated because all of these things. So NAMT is down-regulated, PARP and CD38 up-regulate. What happens is with all this, the level of NAD is decreased. So NAD level goes down as we age. Now, this is a very important molecule, especially if you heard about David Sinclair. He talks a lot about NAD, and he has developed NAD precursors also in anti-aging medicine. So this is something we have to understand. Now, coming to a very important thing in anti-aging is autophagy. You know what is autophagy? Autophagy means destroying unwanted cells or cleaning up unwanted cells and debris from our body and cells. So what is the biggest way to activate autophagy? It is fasting. Fasting activates AMPK and sirtuin pathways. So there are two pathways, AMPK and sirtuin. Both are very helpful for delaying our aging. It lowers insulin, fasting lowers our insulin resistance, it makes it less. Fasting decreases senescent cells. Now, these are I would say the senescent cells are the cells which are very important for increasing our aging. And whenever senescent cells are present, they release something called senescent associated secretory phenotype and inflammation, SASP. So SASP is the inflammatory cells which senescent cells secrete. These cells create a lot of inflammation and damage in the body. Fasting decreases weight, improves metabolic disorder, and help to prevent or delay heart disease, neurological disorders, hypertension. So you can see how autophagy is very helpful in removing unhealthy cells, maintaining intracellular health, decreasing inflammation, shifting utilizing glucose to ketone consumption, and removing unhealthy proteins and immune cells. So autophagy is something very important. Calorie restriction and fasting is very important for our anti-aging. You know, there are stages of fasting, and we can look as we prolong our fasting, we enter into ketosis and we start generating, a lot of benefits out of it. The different kind of fasting, intermittent fasting, then there are 5 days normal eating and 2-day fasting, like that, different fasting. I'll come to what are the supplements for anti-aging. Now, they can be foundational supplements, nutraceuticals, botanicals and adaptogens, interventional supplements, bioidentical hormones, nootropics, and then peptides. All have role, but when we are starting, as I said, always start with the foundational supplements, then build upon them. So the foundational supplements like normal vitamins, minerals like vitamin D, E, K, A, B, and C. So these are the normal thing, magnesium, calcium. Magnesium is really very important to build upon. The nutraceuticals that are important for anti-aging are like N-acetylcysteine, alpha-lipoic acid, probiotics, coenzyme Q10, omega-3 fatty acids, and taurine. Now, these are really very important. I put all people who want to be on the anti-aging, besides giving them all the basic nutrients, I would like them to have all these to help them in anti-aging. Now, botanicals like ashwagandha, rhodiola, astragalus. Now, astragalus is very good for decreasing your telomere length, preventing the decrease in the telomere length. Tungatali, which keeps your testosterone level, ginger, and turmeric. Turmeric has curcumin, which is very important for decreasing our inflammation. These are important botanicals which we can add. Now, there are some nutraceuticals which you have, when you corrected your diet, your exercise, you have built your normal thing, then you should add on them because they have a lot of role in preventing your aging. Like metformin and berberine, they can both activate AMPK and they also they create caloromimetic effect. They make your body believe as if you are on fasting state. Rapamycin is coming as a very strong mTOR inhibitor. There are a lot of studies going on rapamycin to prolong the age. Senolytics. Now, I tell you, senescent cells are very important to promote your aging. How can we reduce senescent cells? Senescent cells can be decreased by senolytics like dasatinib, quercetin, phenestrine. They can reduce your senescent cells. Sirtuin boosters like resveratrol are very, very important. Sirtuins are very important as the anti-aging pathways. NAD boosters like niacin, NMN, NR, they boost ATP level. Spermidine activate autophagy. So spermidine is a very good supplement that can also make you body anti-age. Low dose lithium has come up in a big way as an anti-aging supplement. Now, whenever I'm working, like to work with hormones. I work with bioidentical estrogen, progesterone, testosterone replacement therapy. I work with low dose growth hormone. I don't give full dose. And especially I'm working with the TRIM trial where I give low dose growth hormone with DHEA and metformin. And there's studies that are telling with the TRIM trial using low dose growth hormone with DHEA and metformin. If given for 2 years, we can reverse a lot of the parameters of aging in a big way. And this is something I'm a big fan of, the TRIM2 trial. The nootropics, these are something very good for preventing Alzheimer's and memory loss, like paracetam, ceticoline, salbutamine, caffeine, theanine, and likewise. Peptides are the big thing, and I am very fond of them. But unfortunately, we have a lot of problem in getting peptides in India. I have some idea with using BPC 157, and I'm happy with the results. I've used TB 500, some of them, but I'm still interested to use MOTSC, SSR 31, apithalin, thymosin alpha, and apamorelin. So I'm looking for reliable sources. This is something that can really help in anti-aging medicine. So there are a lot of advantages of using supplements, especially if you're using it along with, basic foundation, your diet, your exercise, and sleep are the foundations. You have to build upon them, not bypass them. So improve nutrition. They improve your nutritional status. They improve antioxidant level. They improve your cell metabolism, prevent cancers, boost level of energy, decrease inflammation. They prolong life and longevity. They can repair your damaged cells, optimize hormones, remove senescent cells, and boost autophagy. Sleep is very important in anti-aging, and 5 to 7 of our sleep is very important. And more sleep is not good. More than 8 hours have its own effect. There are phases of sleep like sleep, awake state, light sleep, slow waves, deep sleep, REM, and sleep spindles. So, light sleep is when we start entering into sleep. Slow wave deep sleep is where we go deep and a lot of hormones are released. Growth hormone and testosterone is released in deep sleep. REM sleep is when we're having dreams. It decreases the activation of frontal lobe and really help us to relax. It is said 4 to 5 cycles of REM sleep are needed in a good sleep cycle in a night. Sleep spindles are very important. They help us to activate thalamus activation. So there's immense advantage of having good sleep. And there's studies if you're not sleeping adequately, your incidence of cancers go up, autoimmune diseases go up, and there's nothing that we can bypass a good sleep. It improves your tissues, it improves HRV. There's a lot of healing that happens in the brain. It releases a lot of hormones like growth hormone, testosterone, melatonin, and balances immune system. So it consolidates your memory, it decreases inflammation, improves learning and cognition. I think one of the reasons why people age is they're not sleeping adequately and you're getting addicted to a lot of media. So decreased or interrupted sleep is linked with a lot of problems, hormonal imbalances, depression, low mood, and also immune disorders. So see, this is one thing. As one gets old, the quality of sleep decreases, REM state and slow wave deep sleep decreases, secretion of various hormones go down. So it's very important when you want to replenish your hormones, make your sleep, improve your sleep. That's very, very important. Matt Walker he's the neurology and psychology professor from Ulca and Berkeley, that sleep is not as a lifestyle luxury. It is a non-negotiable biological necessity. It is a life support system and nature's best effort to promote immortality. So, very important, sleeping adequately is very important to help us in anti-aging. So you have to track our sleeping. How can you track them? There are a lot of apps now available like Fitbit, like Whoop, like Aura Ring. Apple One phone is also coming with it. Use any of them, track your sleep, make it adequate, make it good. And you have to improve your sleep quality, avoiding blue light, avoiding caffeine, exercising before bed, using melatonin. All these things are very important. Melatonin is really coming as a good sleeping aid, but you have to combine it with other lifestyle modification. Blue light, as we know, we should avoid it to have a good sleep. So all good sleeping, good hygienes, like having regular routine for sleeping, meditating or journaling before sleeping, avoiding blue light and all media like laptops, phones, avoiding caffeine before bed, having simple ritual to promote sleep, and keep your room dark, distraction free is something very important. Okay, so there are a lot of studies that are telling that a lot of diseases are linked with sleep deprivation, like hypertension, diabetes, stroke, cognitive decline, immune alterations, and even cancers are linked with the sleep deprivation. Now, very important thing in anti-aging is strength exercising. And it's as we grow old, we lose muscles. This is something we have to understand, and we call it sarcopenia. A study that is telling that men lose up to 10% of muscle per decade as we age. The only way we can prevent is by doing exercises and resistance exercises like weights or body weight trainings or like dumbbells or something. Resistance exercise is very important, and that must not be, that must be included in our program. And also, when we do all these resistance exercises, it strengthens our bones. It prevents against osteoporosis. Now, one big reason as we grow old, the incidence of fractures of the bone go up. So to prevent that bone fractures, it's very important to make your bones strong, and resistance exercise is one of the best way to strengthen your bones. It boosts metabolism, decrease insulin resistance, and help to maintain a healthy weight. So you must do various body weight trainings, resistance bands. You can also do weight trainings under guidance and under supervision. If you're not doing it correctly, you can injure yourself and harm yourself. So in our old age, when we are doing exercise, you must be consistent. Start slow, gradually build up. Start with first like body mobilizations, flexibility, then add cardio, then add to that endurance and strength. Later on, you can add body weights, TRX bands, and then weight training. Weight training is like that, that gives maximum benefit, but you have to go step by step, slowly building up and then avoid injury. So there are immense benefits of exercise. I can say that exercise is something that should always be a part of anti-aging plan. It improves mitochondrial health, it improves nutrient sensing, decreases insulin resistance, improves the intracellular communication, lowers down your lipid profile, increases HDL, it decreases aortic stiffness and increases telomere length. Then coming to gut microbiome, it's very important, to maintain your gut microbiome, to have healthy biodiverse microbiome, especially Akkermansia are very, very important. Faecalibacter are important. Bacteroids are important. They should be increased. On the other hand, proteobacteria are the one that cause inflammation. They should be decreased as we grow old. So that's very important. And we have to check our gut microbiomes. If there are any pathological microbiome, they should be removed. And they're missing one, we should always add to that. We can use pre and probiotics to optimize our gut microbiome. We have to use, organic food and optimize our sleep and exercise. Balancing gut microbiome is very important for anti-aging. Again, it's a revision. that there are two pathways, anabolic and catabolic pathways. AMPK is a catabolic and pathway. Even sirtuins are also catabolic pathways. Insulin and insulin-like growth factor 1 and mTOR are anabolic pathway. These anabolic pathway promote aging, and this pathway decreases aging. So this is what I can say. How can we activate our AMPK? Like spermidine, berberine, alpha-lipoic acid, curcumin, EGCG, quercetin, fish oil, fasting, and high-intensity exercises. Okay. When AMPK is activated, then mTOR gets deactivated. mTOR creates toxic cells and senescent cells. AMPK clears them. Focus on AMPK if you want anti-aging. Autophagy, we talked about. mTOR inhibitors like rapamycin and metformin, they are very important. And rapamycin coming in a big way as an anti-aging substance, and a lot of studies going on. But metformin is still there, and it can cause calorie restriction. Now, sirtuins, there are 7 sirtuins. Sirtuin 1, 6, and 7 are in nucleus. 3, 4, and 5 are in mitochondria. Sirtuin 2 is in mytoplasm. And you know what activates sirtuin is the NAD molecules. So when we increase NAD, the sirtuins go up. Sirtuins increase the longevity and decrease aging. So what sirtuin genes do? They increase mitochondrial biogenesis. They repair DNA. They activate PARP. That is the poly-ADP ribose phosphate, which increases the cell repair. Now, this cell damage happens as we grow old, and PARP is a very important molecule to repair the cells. They help in cell communication between nucleus and mitochondria. They improve communication between hypothalamus and fat cells, activate autophagy, they increase apoptosis, and they are activated to the presence of NAD. So that is why NAD is very important, because it's going to activate SERT genes, and SERT gene will have all anti-aging. Now, what we have to understand, as we grow old, our NAD level goes down. But why does it go down? Because there's a molecule called CD38. This marker goes up as we grow old. Now, CD38, one molecule of CD38 can consume 100 molecules of your NAD. It can swap them, it can mop them. And you need 10 molecules of NAD to generate ATP. 36 molecules of ATP require 10 molecules of NAD. So NAD is needed to generate energy, and CD38 destroys your NAD pools. So that's very important.
Excuse me, sir. So
yeah.
1 minute remaining.
Okay, so you need NAD boosters to activate your NAD, and lot of things. There are a lot of NAD boosters now available. So you can do NAD precursors, niacin, niacinamide, nicotinamide ribose, decrease CD38 by epigen and phystein, reduce senescent cells, resveratrol, and this. Okay, so these are the various things. Senolytics, again, dasatinib, quercetin, or physentis can decrease our senolytic cells. So telomeres are also very important. As we age, our telomere becomes shortened. And how can we decrease our telomere attrition? By fasting, by high-intensity exercise, hyperbaric oxygen, reducing insulin level, astragalus, omega-3 fatty acids, and vitamin D. We can use a lot of tracking parameters, we can use a Fitband and a lot of the other things which can track blood sugar, heart rate, blood pressure, sleep patterns. So this is something variables that can track various parameters. Fitband is one of them. You can use them, and this is the protocol that I am using. As I said, I think I can. It's okay now, and इसको बंद कर दें.
Yeah, can you please unshare the screen, sir? Thank you so much, sir. I guess your video is gone.
Oh, yeah.
Please come back on the video.
I'm trying to come.
Yeah.
I think my program has got a little stuck.
Yeah, that's absolutely fine. Thank you, Dr. Sandeep, for clubbing, I guess, each and everything, the food, sleep, stress, exercise, nutrition, how autophagy plays an important role, how fasting plays an important role in autophagy, metabolic pathways are there important in anti-aging. There are certain questions in the chat box, sir. If you can stay back for some more minutes and could answer those questions, it would be a great honor, sir. Thank you so much for joining us.
Yeah, can you hear me? I'm there, but I'm not able to come back into the screen.
Yeah, that's absolutely fine. So as we have to move to the next speaker, you can please answer the questions in the chat box. and give valuable answers to the people over there. Thank you.